Hello my dear friends, I am Professor Kishore Chandra Prasad, E.N.T and head and neck surgeon. Today let me talk something about the pain in the ear. Hope you'll enjoy. Listen to some of the important diseases of the ear, nose and throat, because most of the diseases of the ear and nose, throat, if treated early, we can avoid a lot of complications. The ear, nose and throat is an area which is very closely related to most of the important structures of the body, that is the brain, the eyes, the endocrine organs like pituitary gland and the great important nerves which travel from the brain down, that is called as the cranial nerves, and also the spinal cord. So since these areas are very closely related, any diseases of the ear, nose, throat can give rise to complications to these areas which are dreaded and which is difficult to treat at a later time. So if the diagnosis is done right in time, I am sure we can avoid most of the complications. To start with, I will just say some of the important causes of the ear pain and how to manage the ear pain. Ear pain usually is mainly because of the diseases of the external ear, middle ear, or sometimes it can be because of the inner ear. As we know, we have got three parts in the ear: the outer ear, middle ear and the inner ear. The outer ear is separated from the middle ear by the tympanic membrane. Usually, if there is any infection in the external ear, it can be in the pinna. So, in the pinna, you can have some diseases like perichondritis, there can be a seroma, there can be some collection of fluid in the external part of the pinna between the cartilage and the skin. So this can easily be treated by aspiration and putting a tight pressure bandage, or if it has gone for a perichondritis, it has to be treated vigorously by surgical procedures. Otherwise, there may be a deformity of the pinna. The next area where the ear pain can start is in the external auditory canal. The external auditory canal is the area which is starting from the outer part going towards the tympanic membrane. So this is the tympanic membrane, what we call it as the tabla, which separates the outer ear from the middle ear. So any infection in this area can give rise to ear pain. And the most common is the fungal infection, or sometimes it may be a foreign body, or it may be sometimes just the way we clean the ear by some cotton buds or by stick. It can give rise to a trauma to the external auditory meatus, giving rise to pain. So these diseases of the outer ear is called as otitis externa, which can be simply treated by nice cleaning of the ear, by some medication, some applying the ointment and the ear drops with a regular suction clearance of the external auditory meatus. A fungal infection is also another important cause in the external auditory meatus, which can give rise to pain in the ear. This fungus is a whitish, that is a candida, which is present in the external auditory meatus, which also give rise to pain and itching of the external auditory meatus. This can be treated by a regular suction and using some antifungal ear drops. The other area where the pain can elicit is from the tympanic membrane. A tympanic membrane is a structure which has got three layers. The outer layer of the tympanic membrane sometimes gets some blebs. There may be some swelling on the tympanic membrane, which we usually call it as bullous meningitis. So these blebs are very painful and it can be due to some viral diseases. The tympanic membrane can also bulge outside because of some of the mid-ear infection. In the mid-ear, if there is a fluid, the pressure of the fluid in the mid-ear pushes the tympanic membrane outside, and this bulging of the tympanic membrane is very painful, and the patients usually come with severe ear pain. Now, the mid-ear infection can be something like a serous otitis media, or it can be a pus in the middle ear. A serous means it is just a fluid in the middle ear. Because of the blockage of a tube called as a eustachian tube, this is an eustachian tube which connects the middle ear into the nasopharynx behind the adenoids and the tonsil. So this tube, when it is blocked, can give rise to fluid in the middle ear. So this also can be treated by seeing that the eustachian tube is open, or sometimes we may have to make a small hole in the tympanic membrane and remove the fluids. Together with a course of antibiotics, the middle ear infection can be controlled. Sometimes you can go for a serious type of middle ear infection called as a cholesteatoma, where there is a extra the epithelial line or the skin of the external outer meatus which protrudes into the middle ear, which give rise to a foul smelling ear discharge with the pain. So this has to be treated by surgical means after doing a thorough investigations. The other reasons for the pain can be a tumor in the ear or any malignancy of the ear, which can also give rise to pain in the ear, which has to be investigated thoroughly and then managed according to the stage of the disease or the part that is involved with the external ear, middle ear or the inner ear. So all these tumors and the malignancy has to be treated after thorough investigations. Now the ear pain need not be just because of the diseases of the ear itself. There is something called as the referred pain. If there is any tooth pain, the patient sometimes complained of ear pain also. If there is any lesion in the base of the tongue or on the side near the tonsils or in the, that's called as the anterior pillar of the tonsils. So these areas can also give rise to referred pain. That means the disease is somewhere else, but the pain is referred to the ear. So pain in the ear has to be thoroughly investigated, examined properly to see whether there is any lesion in the tongue or anything in the oral cavity or sometimes in the nasopharynx, that is behind the nose, the area called as the nasopharynx. So all these areas has to be examined properly, and we have to diagnose what is the cause of pain and treat it according to that. So as I told you, it's a simple problem, but if treated well in time, I'm sure the complication can be avoided. Thank you.